The Northern Hemisphere is in the midst of its annual battle with respiratory illnesses. This season typically runs from October to May. It brings a wave of viruses, including the flu, COVID-19, and RSV. This year has been fairly typical so far. However, there have been some notable trends worth watching. One unusual season was 2020 to 2021. During that time, COVID-19 precautions led to a significant decrease in flu and RSV cases. This year, we are seeing a return to more predictable patterns for these viruses. Despite the typical season, it's crucial to stay informed about the latest developments. Understanding the current state of these illnesses can help us make informed decisions about our health. It is also important to remember that even a typical season can be challenging. Many people still get sick and require medical attention. This winter, we saw a peak in flu hospitalizations around January 4th. While hospitalizations declined after the peak, they have shown a slight uptick recently. This season's flu vaccine may be less effective than in previous years. However, it is still the best way to protect yourself from serious illness. COVID-19 hospitalizations are lower this winter compared to the past few years. This is likely due to widespread immunity from vaccination and previous infections. Wastewater levels of the virus, which can be an early indicator of spread, have fluctuated. They peaked, declined, and are now slowly increasing again. RSV, a common respiratory virus that can be particularly dangerous for young children, is having a fairly typical season. Hospitalizations peaked earlier in the season and are now declining. The introduction of new RSV vaccines for older adults and pregnant people may be contributing to this milder season. While we are seeing some encouraging trends, it is important to remember that these viruses are unpredictable. We must remain vigilant and continue to take steps to protect ourselves and others. Norovirus, a highly contagious stomach bug, is making headlines this winter. There has been a significant surge in outbreaks across the country. This increase is attributed to a combination of factors. A new mutation of the virus appears to be more easily transmissible. Additionally, reduced population immunity may be playing a role. This means that more people are susceptible to infection. Norovirus causes unpleasant symptoms such as vomiting and diarrhea. It can be particularly dangerous for young children and older adults. Unlike some other viruses, hand sanitizer is not effective against norovirus. The best way to protect yourself from norovirus is to wash your hands frequently with soap and water. If you are sick, stay home to prevent spreading the virus to others. As we navigate this winter's wave of respiratory illnesses, there are several things you can do to protect yourself and your loved ones. These simple yet effective measures can significantly reduce your risk of getting sick. First and foremost, stay home if you are feeling unwell. This helps prevent the spread of germs to others, especially those who are more vulnerable to complications. Wearing a mask in crowded indoor settings can also provide an extra layer of protection. This is particularly important if you are at high risk of severe illness. Finally, make sure you're up to date on your vaccinations, including flu and COVID-19. Vaccination remains one of the most effective ways to protect yourself and your community from serious illness. By following these simple steps, we can all do our part to stay healthy and safe this winter season.